Assalamualaikum everyone. So in this video we are going to do the effect of the carbonic anhydrase inhibitor on the proximal convoluted tubule as a diuretic action. So normally the normal mechanism is already explained by me in the previous video. So in this we're going to do the effect of the carbonic anhydrase inhibitor. So what's gonna happen, the carbonic anhydrase is obviously responsible for the conversion of the um, uh, carbonic acid into the bicarbonate ion and the hydrogen, and then the hydrogen is gonna go outside the cell into the lumen where it's gonna combine with the bicarbonate, and the carbonic acid is formed, and then water and carbon dioxide is gonna be coming inside the cell, as well as the hydrogen is going to be combined with the NH3, which is going to convert the which is going to be converted into NH4, the ammonium ion, which is going to be excreted, and that's what normally happens. But if someone is going to be given the carbonic anhydrase inhibitor, so what's going to happen, the sodium is not going to be absorbed, the bicarbonate level will also be increased in the urine, the sodium level will be increased, the amino acid glucose level will also increase in the urine, as well as the potassium level will be increased in the urine. So in short, there is going to be loss of the sodium, potassium, bicarbonate, chloride, amino acid, and glucose, and it's going to cause the alkalinity of the urine. Okay, and the potassium loss is because there is going to be no there's going to be no hydrogen loss. Okay, now we're gonna do the uses of the carbonic anhydrase inhibitor. So remember, to remember that, you need to remember the mnemonic GAME, GAME, and G is glaucoma, the acute and the chronic glaucoma. It's going to be used in acute mountain sickness. It's going to be used in the epilepsy and the familial periodic paralysis, and it's going to be used in the alkaline, makes the urine alkaline, because if someone is having acidic urine or acidic poisoning, so we're going to give the carbonic anhydrase inhibitor, which is going to convert the urine into basic form, and that's it. And there is the adverse effects. So to remember the adverse effect, just remember the basic concept and you're gonna be good to go to remember the adverse effects. So there's gonna be loss of sodium, so hyponatremia. There's gonna be loss of potassium, which is hypokalemia. There is gonna be increased level of the hydrogen in the body, so metabolic acidosis. Then we're gonna have the hypertensive reaction, hypersensitivity reaction, and they're gonna be renal calculi and headache, skin rashes, fever, nephritis, etc. And the contraindication, the carbonic anhydrase is going to be contraindicated in two things. To remember that, you just need to remember, like on C there is, just remember C, and on C just write 2. So we are not gonna give in hepatic coma and COPD. What happens in hepatic coma, the NH3 level is really high, so if we give a carbonic anhydrase inhibitor, so which makes the NH3 level in the body more, because the excretion of the NH3 is going to be reduced, because when there is no carbonic anhydrase inhibitor, so NH3 is going to combine with the hydrogen and kind of form the NH4, which is going to be excreted from the body. So we should not give carbonic anhydrase inhibitor in the hepatic coma as well as in COPD. It's gonna make the body more acidic, metabolic acidosis will happen, so that's why we should not give it in COPD. That's it. Thank you.